Good afternoon, and welcome to Let's Talk, our Opioid Misuse Prevention and Treatment Education Series, brought to you by Capital Area Human Services, the Louisiana Department of Health and Office of Public Health, and the East Baton Rouge Parish Library. Today, our topic is opiates and how to protect your loved ones. Let's have a brief introduction of our team members who put this talk together. We'll start with Jessica. Will you introduce yourself and tell us your title?
Hi, I'm Jessica McDaniel. I'm with the East Baton Rouge Parish Library. I do community programming and outreach here. I am going to be behind the scenes, making sure, hopefully, that this runs smoothly as all technology is.
Thank you. Ricky Davis, please.
Yes, I'm Ricky Davis. I am the Prevention Project Coordinator for Capital Area Human Services. This is our second Let's Talk event, and we're very excited to be able to engage within our community to provide you with additional information on how you can help save your loved one's life.
Wonderful, thank you. Don Collins, please unmute yourself and introduce yourself.
Oh, you're still muted, Dawn.
I clicked it. I thought I clicked it. I'm sorry. Good morning. This is Dawn Shanae Collins. I am a prevention coordinator as well with Capital Area, and I focus on opioid prevention misuse, prevention of the misuse of opioids.
I know it's a lot. It's a mouthful. Thank you, Don. And Vivian Getz.
Yes, hi, welcome everyone. My name is Vivian Geddes. I'm the Prevention Division Director at Capital Area Human Services, and I hope you enjoy the presentation.
Thank you, thank you. So during this hour, you will receive very informative presentation about opiates from a pharmacist's perspective. And after her presentation, we're going to play a game, a trivia game, to see how much you've learned and know about keeping you and your loved ones safe regarding opiates. So to play the game, we're asking for 4 volunteers to play the game with us. And to volunteer, all you have to do is just put your name in the chat box. And the first 4 that we get, we're going to call on you when we get ready to play the game. All right? So we'll be looking for the names in the chat box. Now I'd like to introduce you to our speaker today. Dr. Natasha Seals is the Louisiana Opioid Pharmacist Education Coordinator for the Louisiana Department of Health. Dr. Seals provides educational opportunities for independent pharmacists across all parishes in our state as it relates to the 2016 CDC opioid guidelines and public health outcomes as outlined in the Overdose Data and Action Initiative. Her primary focus includes the following: available treatment options, recognizing signs of addiction, red flags involved in opiate dispensing, mitigating accidental exposure and safe storage, understanding the guidelines for responsible dispensing, and Narcan counseling tools. Dr. Seals is a practicing pharmacist of 17 years. Her professional role includes pharmacy management, healthcare services for HIV and indigent care patients at a fairly qualified healthcare center, prescription review specialist for workers' compensation, medication therapy management, and a certified immunization pharmacist. Dr. Seals is a graduate of Xavier University of Louisiana College of Pharmacy, where she obtained her doctorate of pharmacist degree. Dr. Seals resides in Baton Rouge, Louisiana, with her husband and 2 children. And as Dr. Seals is speaking and providing this information, if you have any questions, you can place them in the chat and we will cover them either halfway through or at the end of her presentation. Welcome, Dr. Seals.
Hello, everyone. How are you today? I would like to take a moment to start my screen share, so give me one moment, please. Can you see the screen, everyone? Ms. Trudy?
Yes.
All right, thanks a bunch. So today we're going to speak about opioids and strategies to protect your family. We're going to go straight into the presentation and talk about understanding pain and the multiple layers of pain. The International Association for the Study of Pain defines pain as following: an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. It is important to note that in 2020, there's a revision to this definition to include the portion that says or resembling that associated with. And they found this to be important because pain is a personal experience that is influenced by many factors. It can be biological, it can be psychological, as well as social factors. The concept of pain is actually learned through experiences throughout life. And it is important to note that we need to respect the concept of pain. All of this is important because understanding pain and how it is treated is important to educating both yourself and your family about safer opioid consumption. On this next slide, we're just going to take a few minutes to look at the different types of pain that you may experience when you go to see your doctor. It can be nociceptive or inflammatory pain, which essentially means it's damage to your body tissue. You can further take this particular type of pain and break it down to either a visceral type of pain, which is pain from like your internal organs, such as the stomach ache, or it can be broken down to something called somatic pain, which is more localized. And this affects your extremities, something like perhaps your legs or your arms or face or tendons. Often this pain is described as either a sharp pain, an aching pain, or a throbbing pain. And usually it is categorized as an acute pain of sudden onset. This next portion refers to neuropathic pain, or something that affects nerve lesions. This can be either a continuous type of pain or episodic, and continuous meaning essentially it's ongoing, or with episodes, it comes and goes. This particular pain can be affected by non-painful stimuli, such as light touch, or even some people will say that things such as the rain, like we've had the past few days, or even cold weather, can cause flares with this type of pain. It's often described as either tingling, shooting, or a burning sensation. This last section of pain actually refers to a CNS dysfunction type of pain. The CNS area is located in the brain stem, or your spinal cord, and essentially there can be no clear evidence of any actual tissue damage, but you know there's some type of pain there. This type of pain can be associated with something such as a stroke or from MS, a brain tumor, or even spinal cord injury. We're going to take this information, look at it just a little bit deeper, going into when you actually go into the doctor's office and what you're reporting as your pain to be. Pain is traditionally broken down when you go see your doctor as either an acute pain symptom or chronic pain. Acute pain is something that actually serves a purpose. It's warning your body essentially that something has happened. So for instance, if you kick your toe or something like that, you're going to have your body's going to give you a response saying essentially something has happened. There's some type of injury. It can last for a few moments, or in the event with that same particular example of your a toe pain, if you actually broke a bone, it can last a little bit longer. And for this type of pain, we want to focus on the treatment because traditionally it will respond to a treatment such as either anti-inflammatory or opioids. Now, on the other side of that coin, we have chronic pain. Chronic pain can be associated with any type of injury, and it may not have a clear diagnosis from scans. It does not serve a true purpose, as in your body is not warning you that something has happened. For this particular type of pain, we want to focus on self-management of pain. Essentially, you may have to take this pain and unfortunately have to learn how to live with it as you're coping with the different types of pains or whatever your ailments may be. For this particular type of pain, also it's important to note that you may not respond to the medication. So every now and then, that's why it's important to know and have an established outcome on the front side of what the expectations be. Responsible prescribing for either type of pain right here is key, because as we know, addiction can occur in as little as 5 days. So let's go into methods of pain relief. There are various types. It can be something as simple as exercise, are some type of therapy, such as physical or occupational, massage, or meditation. Now, meditation is one of those things that it activates and reinforces some of the areas of the brain that is used in pain processing. So essentially, the theory is if you have a decrease in stress, you're going to have a decrease in pain. You can also use muscle rubs. They can contain something such as menthol or methylsalicylate, and they're used as counter irritants. So essentially, your body has a cool sensation, then it turns to a warm sensation. This is used to distract your aches and pains from stuff like deep muscle pain. You can also have heat or cold therapy, with heat therapy focusing on improving circulation and blood flow, which in turn can increase muscle flexibility. And on the opposite side, we have cold therapy. It reduces blood flow, resulting in a decrease in inflammation and swelling. And this is kind of important when you're looking at things such as treating joint and tendon area pain. You can use aspirin, acetaminophen, ibuprofen, or Aleve. And remember that these are all over-the-counter measures that are available to anyone whenever you have some type of pain ailment. And then you can go into other things such as prescription drugs. You have anti-inflammatories, muscle relaxants, as well as nerve pills. And also on top of that, there are non-traditional methods such as acupuncture. Some people can even find benefit for something such as aquatic therapy, cognitive behavioral therapy, which essentially is teaching your brain how to respond to pain whenever you have a stimulus, and also electrical stimulation. And this can be found with using this machine such as a TENS machine. Next, we're going to look at our step therapy of care. So when it comes to treating our pain, the World Health Organization, or WHO, says that it should be done in a step fashion. You go from step 1 for mild pain to step 2 for more moderate pain, going to step 3 for more severe pain. With our first step with the mild pain, we're going to do something like non-opioids. You're going to look at something like Tylenol or Aleve in combination with those muscle rubs that I mentioned earlier. In the event that doesn't work, go to your next step, which is mild pain relief. So you take those things from step 1 and add on, if need be, a weaker opioid, such as codeine or hydrocodone. In the event you still have pain and it intensifies, go to the third step. Now you're at severe pain. Now you're looking at stuff like morphine and fentanyl and methadone, those stronger pain relieving medications. So let's take a deeper look on exactly what an opioid is. Opioids are found both naturally in our environment as well as they're synthetic, which means they're man-made. Our natural opioids are found from substances or extracted from something called a poppy plant. And from that, you can get both morphine and codeine. We also have it naturally in our body, and they're called endogenous opioids. And it can either be enkephalins or endorphins. And endorphins, as you know, are those natural highs that you get from something such as exercise, as mentioned earlier, that can be used as a method of pain relief. Another little fun fact is that it's also found that there's an opiate-like substance in your saliva. And this is used, it's called opioid, and it actually stops the breakdown of that substance called enkephalins. So in turn, it helps with your pain relief. So you have natural methods in your body already to help you if there's any type of pain. It can be both legal and illegal substances. And within that, I forgot to mention that your different types of synthetics, my apologies. So for our semi-synthetics, you have both hydrocodone and hydromorphone. And then for synthetics, we can look at stuff like fentanyl, methadone, or tramadol. They are used to treat moderate and severe pain. And the actions are throughout your body. This is important to note because you cannot pick and choose where the opioid works in your body. So while it may cause you to have euphoria and have a better sense of well-being when it comes to your pain, you're also going to get those things like confusion and constipation, unfortunately. So you cannot pick and choose where it works. They can be addictive. It can cause dependence as well as tolerance. On this next screen, we're just going to take a brief look at our common types of opioids. As you see, they're listed on this screen. I would like to take note that for Narcan, this is the combination of hydrocodone and acetaminophen. According to our 2020 data from Prescription Monitoring Program, Narcan continues to be the #1 most prescribed opioid in the state of Louisiana. Fentanyl, which unfortunately is often misused in our state, is 50 to 100 times stronger than morphine as a point of reference. It also lists heroin, which is the actual illegal substance on the screen. It is 2 to 5 times more potent than morphine. What you will not see listed on here is something called carfentanil, but it's worth mentioning. We're seeing this more in the news right now with people having unintentional overdose from this substance. It's actually used as a tranquilizer for elephants. That's just how strong it is. It is 100 times stronger than fentanyl. And remember, I just told you how much stronger fentanyl was over morphine. So unfortunately, people are using this substance to increase the high that's associated with using opioids, and it's causing a lot of unintentional overdoses in turn. Here we look at just a snapshot of the effects of opioids. As mentioned, it affects the CNS system. So you have things like euphoria and confusion. You have slow breathing, which is important when we're talking about opioids because this is what's causing a lot of our unintentional overdose. It causes increased pain sensitivity, as well as nausea and drowsiness, and that last thing being constipation. Now we're going to take a brief look at our 2019 national data. I want to note right here, a lot of people will say, well, why are we looking at 2019? Well, unfortunately, it takes a long time to publish that data. They have to vet the data collected before we can actually publish it for view. So as of right now, we have to depend on our 2019 data for our stats. There was a 74% of drug overdoses in the US involved opioids during 2019. More than 73% of opioid-involved deaths included a synthetic opioid. It's important to note that most of our deaths from synthetic opioids occurs from fentanyl, and it's attributed to something called IMF, which is illegally manufactured fentanyl. And what happens is people will take this particular fentanyl substance and mix it with other substances, such as either heroin or cocaine. And this can be unknown to the user who's actually using the medication or the drug substance, which creates more of an incidence of overdose because when you look at it to the naked eye, they all look the same. So where you may have received just fentanyl the first time, the second time it can either be laced with heroin or cocaine, unbeknownst to the user, creating more of a concern for overdose. From 2014 to 2019, there was an increase of 1,400% in deaths involving fentanyl. And for Louisiana in particular, fentanyl deaths are greater than both heroin and prescription opioids. On this next slide, we're going to look at opioid involved deaths for Louisiana. Between 2018 and 2019, there was a 25% increase in opioid overdoses. When you look at the graphic as a whole, between 2012 and 2019, there was a 267% increase. It's important to note that this data reflects traditional overdose deaths, but also includes deaths not marked as drug poisonings by coroners. So opioids may have contributed for something like a car crash. This next slide looks at more of the data that we collect through Louisiana for both our drug-involved deaths for 2019, emergency department visits, stimulant uses, as well as opioid prescriptions. I would like to note for this particular slide that as a whole for our state, we're seeing a decrease in the amount of prescriptions that are written for opioids. So it's going down over time. But unfortunately, we still remain ranked high for national usage of opioid prescriptions. It's also important to note right here that while we're seeing a decrease in the amount of prescriptions that are written, our overdose deaths are still increasing. So what that tells you is it's not the only problem. Many of our deaths, as I stated earlier, are coming from IMF or illegally manufactured fentanyl. So opioid prescriptions aren't the full reflection of what's causing our increase in overdose deaths. On this next slide, we take a snapshot of emergency department visits between the time of 2019 or the quarter four of 2019 versus quarter four of 2020. We want to look at this because as we all know, 2020 hit us in varying ways, and we want to see how it affected the opioid epidemic. You can see for every category on this screen, for the most part, with all drugs, opioids, and heroin, there was an increase in emergency department visits. It's also important to note that due to stay-at-home orders for our state, many people did not actually report to the emergency department. So it doesn't give you a true reflection on just how many emergencies that there may have been, because some people decided just not to go to the emergency department at all for fear of contracted COVID. This next slide just takes away and gives you some percentages for those key findings. There was a 44% increase in opioid overdoses that reported to the emergency department. There was a 27% increase in all drug overdoses. And there was a 44% increase in heroin overdose emergency department visits. Next, we're going to look at our 2020 preliminary overdose data. And this is something that is preliminary, I have to say that, because they're still reviewing the data. But as of right now, CDC is reporting that there was an increase in fatal overdoses associated with synthetic opioids. This data was collected before and during COVID-19, and the data ended in the 12 months going up until May 2020. Provisional data estimates that there were over 81,000 drug overdose deaths during this time frame. This is the largest number of drug overdose deaths for a 12-month period ever recorded. It's also important to note that most of these overdoses occurred between the time of March 2020 and May 2020, which directly coincides with the institution of the stay-at-home order. So this lets you know that the stuff like isolation and financial concerns and all the things that came with COVID-19 perhaps played a factor in an increase in overdose deaths. There was a 38.4% increase in that same time period leading up to 2019 for June. So essentially going up until May 2020. And so you start before then and go to the year before that, that was a 38% increase. This data shows also that most of these deaths came from, again, IMF. 37 of 38 jurisdictions with available data reported an increase in synthetic opioid involved deaths. 18 of those jurisdictions reported an increase greater than 50%. That's a lot of deaths, unfortunately. 10 of our western states reported an overdose rate of a 98% increase. So now let's do just a quick knowledge check of things that have been discussed thus far. You can put this information in your chat and it's being monitored, I believe, by one of our moderators. Can you quickly tell me what's the number of opioid involved deaths in Louisiana during 2019? That was shown to you on one of the slides. And this is just a good talking point portion of the conversation or this presentation to make sure that you're paying attention to what's happening in your state. Ms. Trudy, you're done. Have we had any answers yet? Because I can't see the chat.
Okay, so we have a question or a comment request from Facebook, and it was from the lovely Courtney Robertson. Earlier when you were explaining alternatives to opioids, she mentioned, can you also share information about other legal alternatives such as CBD, kratom, marijuana, and small doses of psychedelics?
We cannot in this particular conversation because kratom, while I know is something that is used, there's a lot of conversation around it because you get kratom from places such as gas stations and things of that nature. And I do attend seminars that talk about that. And it's not a substance that's actually, I don't want to say legal or illegal, but it's not something that I really want to speak about in terms of usage. In reference to pain use, you should be using things that are over the counter that I already mentioned, such as CDC guidelines, Tylenol, ibuprofen, things of that nature. In reference to using kratom, I cannot say that you should be using that. Now, there is information about marijuana usage. And essentially it says that people who can legally use it, who have prescriptions, are saying that it actually decreases the uses of opioids over time because essentially you're using a more natural method, but of course it should be monitored by your physician.
Okay, and then I have a question when you talk about the cold versus hot. So I have chronic pain and I have bulging discs, and I'm just now learning that with someone, a cognitive behavioral health specialist that deals with pain was saying, well, you know, it kind of is, she didn't say it like this, but keep a long story short, it kind of is in your head. So I'm wrapping my head around Oh,
So I will say, Miss Dawn, as I said earlier,
yes, ma'am.
you have to respect your pain, because how you experience pain and how I experience pain are two different things.
Mm-hmm.
My internal clock or my biological response to pain is different from yours because you have a different makeup.
Mm-hmm.
You also have social factors that determine in how you experience pain over time, things that have happened to you in your life. So it's not for me to say or anyone to say what your chronic pain may be. But at the end of the day, once you realize whatever the diagnosis is, you have to have a conversation with your physician to say, what is the realistic outcome for whatever it is that you may be treating? Because once you know that, we can better treat and tailor your prescription to what your needs may be. And I know we're talking, I apologize to our audience. While we're getting these other questions coming in through chat, I do know that you can actually see the questions on the screen. So please go ahead and answer and put your answers in the chat. And hopefully we can see that at least with 1 through 3, you have the correct answers. Do you have anything else in chat for me, Miss Dawn?
So a quick refresher for myself and how have been managing my pain. The hot cold packs. So I love them. I got a million of them in the freezer. My sister bought me a nice water bottle, all kind of stuff. But, sometimes over time you forget when you're supposed to use which. So can you help refresh us on?
Traditionally, when you have an injury, you do cold first, heat later.
Oh, so I'm past the ice feels good.
Traditionally, when there's an injury,
like to be
cold is first and heat comes later. Yes, ma'am. And then also you want to look at the type of injury that you have in reference if you're using cold therapy or hot therapy. Because as I said, for heat, you're trying to increase circulation. So if that's the type of pain that you had and you need to increase circulation, you want to use heat. Versus with cold therapy, like I said, like when you get hit in the eye. That's the best way I can look at it, Miss Dawn.
Okay.
When that happens, you use cold therapy initially because it helps to decrease the blood flow to that area.
And the inflammation.
Yes, ma'am.
Okay. All right. And then Miss Trudy said, if doctors aren't prescribing opioids, where are the opioids coming from for these increased overdoses?
That's going to come later in the presentation.
Okay. And I shall put myself back on mute because that's all we have for now.
So, but do we have any answers for questions? So number 1, did anyone have an answer for number 1, perhaps in the chat? The number of opioid involved deaths?
Not in the chat. They may have been waiting for me to sit here and
okay.
and take a stand.
So I did want to encourage audience participation for that to make sure we were catching the things that were discussed thus far. Just in case you don't know, the answer is 588. What type of opioid appears to have contributed most to the surge in fatal overdose deaths? That would be fentanyl or synthetic opioids. For number 3, how many steps are on the WHO pain ladder? Just in case we're not having participation in the chat, the answer is 3. And what is the recommended as the first level of treatment option? That would be non-opioids with additional such as a muscle rub. Our last question was really something that I wanted to encourage audience participation in was, have you ever misused a prescription opioid? And if yes, how? So if you wouldn't mind, I want to give them a few seconds to see if someone gives answers to number 4.
And then during your presentation, you did clarify that it's not such a taboo question. Misuse could be as simple as the doctor said take 1, but that time the pain wasn't as bad, so I took 2. But that ain't what the
we're gonna get into it. Yes, ma'am.
You have a reason that you on the sofa. Sometimes people just jump. So in case anybody was concerned that it might make a little bad to answer the question, it does not.
So you're absolutely right. So they'll know this is not something that we're trying to make you look bad about, because I myself have misused opioids. So it's not like we're trying to spotlight you. It happens.
Okay. So we do have a question now.
That did answer the question just now. And she said, yes, she had 2 shoulder surgeries, 10 months later, back surgery. So she had a lot going on.
I understand. It happens. So we're going to look at a quick look at opioid tolerance versus opioid dependence. For tolerance, what essentially happens is you're using a prescription opioid and you've been using whatever the dose may be that works for you over an extended period of time. All of a sudden, whatever that dose was that you were taking, it no longer works. So you have developed an opioid tolerance. For dependence, this occurs when you're using your prescription around a normal opioid dose. However, unpleasant physical symptoms occur when that medication is stopped. It's important to note that physical dependence does not equal addiction, but it can lead to one. So now we're going to get more into that opioid misuse versus opioid addiction. For misuse, this refers to utilizing the prescription in a manner other than prescribed. So let's give some quick examples here. So if your doctor tells you, as Ms. Dunn was saying, they told you to take it once a day, and you're laying on your sofa or wherever your body may find itself to be at that time, and you're saying that doctor didn't know what they were talking about. I had this pain again, so let me just go ahead and take it twice because I feel as if though I need it. That is categorized as misuse. If you receive a prescription from your dentist for tooth pain and you didn't finish the prescription, and later on some other type of injury may happen, and you decide to take that medication for that injury, that is also misuse. You can receive a prescription and the directions may say to take over the course of 3 days. And as many of us may do, we never truly complete a prescription and you decide to take it for a little bit longer if that pain comes back. That is also misuse. And last but not least, sometimes, not saying you do it, but sometimes people will loan prescriptions to a friend or a family member. That is also misuse. 50% of opioids are given to or taken from a family member or a friend. So it's not that when you see people misusing prescriptions, you're not always getting it from a drug dealer. Only 5% of medications are actually coming from drug dealers. 25% are actually received from an MD. Most of the misuse is coming from you receiving that prescription, either is given to you or is taken from a family member or a friend. 4 to 6% of those that misuse prescription medications transition to heroin. And 80% of heroin users, unfortunately, first misuse prescription opioids. So again, I ask, have you ever misused an opioid? Perhaps now that you have more examples, you would say, I have. However, I want to make sure you know that people that misuse opioids are not always addicted. Opioid addiction occurs when there are attempts to cut your dose, but unfortunately, those attempts to cut it leads to a failure to be able to fulfill your obligations at either work, school, or home. This addiction comes after the person has developed an opioid tolerance or dependence, and essentially it makes it physically challenging to stop that medication. And I also want to take a moment to say that there is no stereotypical type of person that addiction happens to. You can be black, white, purple, or green. You can be a man or a woman. You can be old or young. It does not matter. You can be rich or poor. It can happen to you. So this slide lists the different signs of addiction in which you can see frequent flu-like symptoms, unexplained weight loss. And for addiction, opioids trigger the release of that substance that I told you about earlier called endorphins, and it's the brain's feel-good neurotransmitter.
You got 5 minutes, Dr. Seals.
I have 5 minutes. Okay. So the perception of the pain boosts that pleasure and creates a temporary sense of well-being. And so when you cut that opioid, you want that feeling back swiftly. And this is the first step to addiction. So I do apologize. I got to try to speed up some, you guys. There are some additional factors for addiction, such as high-risk environment, the environment that you live in, your age. You tend to have more risky behavior based off what age you may be, as well as mental disorders. People addicted to drugs are roughly twice as likely to suffer from mood and anxiety disorders. There's a bidirectional relationship between mental health disorder and chronic pain. And the CDC recommends that when you have a diagnosis of chronic pain, that you're also screened for a mental health disorder. This goes over important facts about overdose. So as you know, the rates are increasing. There was an 11% increase in drug-involved deaths between 2018 and 2019, and a 25% increase in opioid-involved deaths for the same time period. Mental effects are present as well as physical effects. And I also want to take a moment to mention on this slide that it's the leading cause of injury-related deaths. And injury-related deaths essentially means those deaths are almost preventable deaths. So it's something that we should be doing something about. Here are your signs of overdose: pinpoint pupils, limp body, pale skin, loss of consciousness. These are the things you should be looking for if you think someone is in an overdose state. So why is there a rise in overdose? This kind of goes briefly over the different things and reasons postulations may be. People have financial difficulties. People who never thought they would do something before find themselves in a position to divert medication. Misunderstanding between the prescriber and the patient. Mental health disorders, as mentioned earlier. Underlying health conditions such as sleep apnea, respiratory problems, and obesity. Using it with sedating medications such as alcohol. You should never mix your medication with alcohol because it increases your chance of having an emergency reaction or a respiratory emergency. More than half of the people who misuse opioids also binge drink. This slide gives you a quick reference of available countermeasures for opioid overdose. You can use it, such things such as Narcan, which is a nasal spray, which is most common. It's needle-free. And they also have a Vizio. It is can be used through your clothes. It is voice activated, but unfortunately, it is also expensive. The next couple of slides shows you exactly how naloxone works for opioid overdoses. It's an antagonist. It is safe to use. You can get it without a prescription, and when you do have it, you have to make sure you check the expiration date. And also, it's important to note that when you do find someone in an emergency, make sure you call 911. Narcan can work in a matter of minutes, but you may have to do multiple doses depending on the substance that was used. This goes a little bit more into detail about naloxone. It works over the course of 30 to 90 minutes. So we want to make sure that you call 911 when it's used. And if for some reason the overdose occurred from something such as cocaine or alcohol, it will not work. This next slide gives you a visual representation of just how strong the affinity is when you have an opioid overdose. Naloxone will essentially come in and kick in, knock the opioid off the receptor, replace it with naloxone, and remove the person from respiratory depression. I'm just going to say real quickly, this gives you a brief representation of the things that I mentioned earlier about how you should be using Narcan. Alert the person, see if they respond to you, check for signs of overdose, use the Narcan, put the person in a recovery position. If nothing happens after 2 to 3 minutes, get a new Narcan and use the medication again, and always remember to dial 911. On this next slide, we look at our storage and disposal methods. It is important to make sure that you keep your medication locked up and have a plan in place before you get your prescription. There are various ways of disposing of your medication. It can be kitty litter, coffee grinds, available products that you get from your pharmacy, an approved flush list, and they have take-back days twice a year through the DEA in both the spring and the fall. The next DEA take-back day, I believe, is April 24th, so make sure you participate if you need to. It's important that you discard your medication because not only does it save lives, but it protects our environment. 90% of people who get prescriptions don't finish their opioids, and 80% of emergencies for opioids are deemed to be accidental. This next slide just gives you a quick representation of how you can mix it with that substance, place it in a sealed bag, toss it in the trash, and make sure you take importance to knock out your HIPAA information off your bottle. And that's that approved list of flush substances. And if you want to get it for yourself, you can visit drugs at FDA. The last couple of slides, we're just going to take a quick look at questions to ask your doctor or pharmacist when you get a prescription. Make sure you verify the diagnosis. Know what you went in there for. Know what type of medication you're getting. Is it an opioid or is it not an opioid? Verify the schedule that you're going to take it. Is it going to be once, twice, or 3 times a day? And how long you're going to take it for. Make sure you know your expected outcomes. Are there any side effects that you should know about? If you decide that you want to wean off, what are some non-pharmaceutical measures that you can take or non-opioid options that you can take to help relieve your pain? Are there any co-administration concerns, such as are you taking a benzodiazepine? Or are you a person that abuses alcohol, unfortunately? Are you taking something for sleep? All these different things contribute to your increased chance of having an overdose. Disposal options. What's your unintentional risk? Should you be getting a prescription for naloxone or just going to acquire naloxone from a pharmacy? And last but not least, repeat what you heard. Make sure you understand. This last little description on this slide just tells you that we can replace the D for opioid use disorder by doing the following things responsibly. Have dialogue. When you go into your doctor, make sure you know you give an accurate history about what's going on with you so you can get a proper diagnosis. That comes from that effective dialogue. You have to give proper input so you can get better output. Once you get that diagnosis, discuss the decision that was made with your doctor. Make sure you understand what they're treating based off the diagnosis. From that, you go into another discussion. Make sure you have all of your questions answered before you leave that doctor's office. Many times people will sit there and listen to the doctor talk to us, but we never talk back to them after all the decisions have been made. When you get to the pharmacy, make sure you ask your questions to your pharmacist about dispensing. Do you have any questions about the time frame? Specific questions about the medication? And last but not least, make sure you have a plan in place to dispose of your medication, because as you know, misuse is a big factor when it comes to opioid overdose. And last, on this last slide, we have help is just a click away. These are different websites that you can use, as well as phone numbers and resources for both Region 2 as well as 211 if you have a need for any help. And I'll just let the slides sit right here just in case you want to write these down, or if you need to reference them, because the next slide only asks, are there any questions? So Ms. Trudy, I hope I got it in those 5 minutes.
You certainly did. You did a
All right.
fabulous job with that presentation. And we actually have time for some more questions. One of the things that when I started doing this work, I went to a pharmacy to see if I could just walk up and get Narcan. And one of the things that they told me is that there is a standing order. Can you tell us a little bit about, you don't have to have the prescription from the doctor, but the pharmacy can give you, or you can buy it, Narcan. Can you share a little bit about that?
Of course I can. So Louisiana has a law in place that you can, any citizen can get Naloxone without a prescription if there's a need for the Naloxone. You can go to any pharmacy within the state. And essentially that standing order says that it has to be made available for you. Now, I cannot promise you that they will have it in stock, but you can get it without a prescription. And it just says that when you get it, that a pharmacist will dispense it to you, of course. It does not really say if you will have to pay for it or not, because those are different stipulations. And before you leave, the pharmacist will provide you consultation about how you will use Naloxone and when you should use it essentially. So if your risk is increased for respiratory depression because you're on like a benzodiazepine, or you're on a hypnotic such as a sedative hypnotic such as Ambien, things of that nature, or even gabapentin, it increases your risk. So there should be a conversation had at time of dispensing to say you can get Naloxone because it's safer to have it at home versus to not have it in the event there is an emergency.
Thank you.
You're welcome.
Ms. Donna, are there any other questions in the chat box?
No other questions in the chat box, but of course I wrote down a couple of questions. I know y'all love my questions. It helps us with information. And then Vivian has a question as well. Okay, so you had mentioned that because I didn't even realize there was something other than the Narcan. And you said that the other is more expensive. What's more expensive? Like about twice as much? About this, because the Narcan not necessarily cheap either.
Well, it's not necessarily. So I'm going to say this: Narcan has been around since 1971, and it's the most popular version of Naloxone. Vizio is more expensive for several reasons. Number one, the cost of it overall is more expensive, but it's also not as readily recognized on people's formulary or your insurance company. So in the event it's not covered, you're looking at a much greater cost to acquire that countermeasure versus you would be doing for Narcan, because Narcan, for the most part, is more commonly available, and it's also a cheaper product to produce.
Okay. All right. And then you had mentioned if you administer Narcan, it only lasts for so long. So please call the police. Call 911. And I wanted to, because the first thing people think about is the police when they hear 911, make sure we lift up that there is a law on the books that if someone experiences an overdose and you need help, that you don't get arrested.
That is correct. That is called the Good
Anything
Samaritan law.
connected to that.
So you won't have any issues with that. If you think there's an overdose, it's always better to go ahead and try to treat the person, because by giving them Narcan or Naloxone, whatever it may be, you cannot hurt them by dispensing it. If there is no opioids present in the body, you're not hurting the person. But it's also best, if you think there's an overdose emergency, to go ahead and use it.
And then Vivian had the question, and then Sandra just put another question. Vivian's question is, what would you say to someone who is dependent on opioids and wants to reduce their use?
Have a conversation with your doctor. That's where everything starts at, because it's not, you as the individual should not make a singular decision about tapering your medications, because depending on what you're taking, there should probably be step therapy in decreasing your dose, because what you don't want to happen is you decide to wean yourself off and now you have a relapse because it wasn't done properly. What you never want to do is start decreasing and have to go back up, because that creates additional problems. So it starts with having a conversation with your physician. And if you decide that that is appropriate for you, you can create a plan to do so. And in the meantime, ask your physician for other methods of pain relief, such as the Tylenol or the ibuprofen and things of that nature, or aquatic therapy, exercise. People really underestimate the value of exercise and what it does for you in reference to moving your joints and your body as a whole. But there are measures in place, even when you get prescriptions for acute pain, such as Norco. As you know, it's hydrocodone with acetaminophen. Doctors will tell you during that time that if you find that your pain is not severe, it's okay to take Tylenol instead of taking the actual combination medication. The important thing is just to make sure that you're not overdosing yourself on Tylenol and you properly space the medication.
All right, and then last comment / question for us to wrap up with is from Sandra Jones Mitchell. And she mentioned that in Ohio, we are blessed to have statewide partners. She mentioned a partner of Cincinnati has Narcan training twice a month on a regular scheduled basis. Should community-based groups provide Narcan through their communities, throughout their community?
Okay.
All right. Was there a question? She was just making a statement.
Yeah.
Does that sound like a best practice that folks should do is what she is asking?
Well, there are actual avenues for acquiring Narcan through some of the community-based programs. Ms. Trudy may have information on exactly where you can go to get those substances. I think she has it as our OPOP for Region 2, but there are places where you can go and get it in the event you don't get it from your doctor's office via prescription, or just walking up to a pharmacy and asking, can you purchase it at that time?
And
thank you, Dr. Seals, very much.
The capital area does have, I wanted to make, I was going to add this. I know Vivian was worried that I wouldn't. I was just going to let folks respond.
I was going to do it for you, but you do it.
That capital area human services does have Narcan available free for distribution. You just call us up and ask. Now, our main number, I know the last 4 digits are 1906. I don't want to mess up the first 3 digits. Ricky or Vivian, put it in the chat.
Put it in the chat, please. Okay.
So and Dr. and Sandra wanted to say thank you, Dr. Seal. And this wonderful.
You're welcome.
How can we collaborate our Black and Brown communities that are dying? Oh, that's a great question.
That is, and if you want, what you can do is submit those out, if you wouldn't mind, Ms. Summer, because I think Ms. Trudy is trying to get to something. Any additional questions, I would love to answer them. I have nothing but time. We may have to do a question and answer, like in the email. If you want, I can put my email in chat and we can send it to me so we can give Ms. Trudy her time to do her portion.
Thank you very much.
You're welcome. I really appreciate that.
The numbers and emails are in there, and Dr. Seal can answer any questions directly. You can even chat her privately. Just choose her name in the chat. Okay, well, thank you guys. I hope you got a lot out of that. And if I
I was kind of zooming through the chat, Don, but it seems like Sandra is our only volunteer to play our trivia game. Do we have others? If not, I'm just going to go through it, and I'm going to ask Sandra to be our first one. I think y'all might be a little scared of this trivia game. It's not that difficult. First of all, I'm going to call upon you. First will be Sandra. And Sandra, you're going to choose a category and a point value. I'm going to read the statement and you will provide the answer verbally. So you will have to unmute yourself to give us the answer. And then you will be able to see, based on the category that you picked, if you got the answer correct, how many points you earned, okay? So here are the categories. The first category is be your own advocate. The second category is medication scenarios. The third category is safe medication practices. And the fourth category is prescription drug misuse. So Sandra, our first and brave volunteer, would you like to pick a category and a value point? Can you unmute yourself and tell us?
Hello, yes. Okay, and thank you. I would say be your own advocate 200.
Be your own advocate 200. Here you go. Your question, name one thing you should tell your friends or family about opiates and prescription drug misuse. Dr. Seals talked about what is misuse. So what is one thing that you could tell your friends and family about opiates and prescription drug misuse?
Well, you would die, and you're putting yourself in harm's way, for sure.
I'm sorry, I didn't hear you say it again.
I said you can definitely die, and you can put yourself in harm's way.
Okay. So so you would, anything else you would tell them about how to keep yourself and your household safe?
Yes, I would say you have to use as prescribed to you. It says the one thing you would tell your friends and family about the misuse of drugs, definitely don't use them. So don't use the drugs, and you'll be putting yourself at risk. And for the prescription drugs misuse, I'm thinking the same thing.
Yes, yes. All right, so let's go with my answer, but let's see what we have here.
Okay.
So first of all, you said that basically, you said don't share your medication. You want to store them in a safe, secure place, not your medicine cabinet, because anyone has access to your medicine cabinet when they come to visit you or they're in your household. And then you want to take medications only as prescribed. And Sandra, you did mention that one as one, that you want to only take it as prescribed. If it says take one every 4 hours, you don't want to take it one every 2 hours because that's not as it's prescribed. Okay, so Sandra, I am going to, or Dawn, did anybody else volunteer? I'm going to call on Sandra again for a second one if she's interested.
All right, medication scenario. I'll do 200.
For 200, okay. Here we go. My pain prescription label says take 1 tablet every 8 hours. Does it matter if I take 2 tablets every 8 hours if I don't feel like it's working? What would you say, Sandra?
No.
Well, let's see. That is a no. You're correct. So you earn 200 points again. New medications may take longer to feel the effects. Always consult your doctor or pharmacist for further instructions. Isn't that right, Dr. Seals?
That is correct. And I love how Miss Sandra said no. It had an oomph to it.
Great, great, great. Okay, Sandra, I'm gonna give you a chance to do one more and then we're gonna wrap it up because I think we're coming close to our ending time. I have a few other things. So Sandra, try another category, please.
Let's do prescription drug misuse, 200.
Okay, here you go. Prescription drug misuse. All right. The misuse of medication affects all of us in various ways. Where do people most often get their prescription drugs they misuse?
from the pharmacist.
Okay, and where else?
The medicine cabinet, they don't throw out any meds, some of the seniors, they keep them forever.
Uh-huh,
And the
right.
streets. And I would definitely say the streets.
Okay, well, let's see what the answer here says. They get them from family and friends. And remember, we said that the doctors are now cutting back on their prescriptions of opiates. And so very much people will say, our family member may say, I was sick at 2:00 in the morning, and the person on the other side of the bed said, oh, I have some medicine in the medicine cabinet. So that's where some people will get their prescriptions if they're not being prescribed from them directly, and that is a form of misuse.
Yes, thank you.
Okay. Any other comments, Dr. Seals? I'm going to end this, and then we're going to do some announcements.
Oh, no, ma'am. Thank you for having me today. And I enjoyed the presentation. I hope someone received something of interest to them that was presented today. And I look forward to working with you in the future.
Thank you so much. We appreciate it. I also want to say thank you all for joining us and participating in this session. Today is the second of 4 talks that we have through our talk series. Our next one will be a virtual and an in-person at the Goodwood Library. The topic will be The Truth About Opiates, and this presentation is targeted to teens and will be hosted by iCare, led by students from Bel Air, Glen Oaks, and Northeast High Schools. You will be in for a treat where students will be presenting facts about opiates and discuss ways to avoid misusing medications, including positive and healthy methods to cope with life challenges. So after the presentation, the students or the participants will create posters reflecting what they learned. All poster makers will be eligible for a gift certificate drawing. So we want you all to definitely come out to the Goodwood Library if you're local on Sunday, April 18th, between 3 and 4 is a presentation, but we also will have resource tables set up in the library between 2 and 5 on Sunday, the 18th. So please come by. We will have items for you to, resources for you to pick up. And even if you are interested in possibly needing Narcan, we will be able to provide some Narcan distribution at that time. So if there's no other questions, I just, again, want to thank you all for participating. And I will end this presentation. Thank you.